Hi, my name is Ciaran Cosgrave and I'm a consultant in sports and exercise medicine here at the Sports Surgery Clinic in Dublin. I'd like to talk to you today about pain in the lateral aspect or outside of the knee. This is a very common complaint in the clinic, particularly in people who do a lot of running or cycling. And while there are many different causes of pain in this area, I'm going to focus today on the most common cause, which is iliotibial band or ITB friction syndrome. Patients with this problem tend to complain of pain that comes on with their activity. Pain can be quite severe and force you to stop exercising. It tends to settle quite quickly with rest, only to come back again as soon as you resume your activity. So it's therefore a very frustrating condition. And I find that patients often struggle because their treatments have focused on trying to settle the symptoms rather than trying to settle the underlying problem. If you have symptoms such as swelling in the knee, or mechanical symptoms like locking or giving way, it may well be a different explanation for your symptoms that might need to be reviewed.
So if we take a look at the anatomy, I'm talking about pain in this area. And if we look at the ITB, we can see that it's a thick band of connective tissue that runs from the lateral hip to the lateral knee. Taking a closer look at the insertion, we can see that the ITB runs in very close proximity to the lateral aspect of the knee, this bony bump called the lateral femoral condyle, and the repetitive nature of running and cycling, and that repetitive motion of the knee causes increased friction, which ultimately leads to inflammation and pain in this area. So thinking about treatment then, initially we want to avoid the aggravating factor, the aggravating activity to allow things to settle. I find that treatments such as soft tissue work and stretching of the ITB and thigh muscles often only give temporary relief and don't address the underlying problem, which is a weakness in the lateral hip or gluteal muscles. Therefore, rehabilitation needs to involve a program of strengthening for these gluteal muscles. And additionally, the treatment needs to involve a program of improving control in the lateral hip and lateral knee to minimize this friction at the knee. So I'm now going to hand you over to Sam Baida, our rehabilitation specialist, who will take you through your exercises.
Howdy, my name's Sam Baida, a senior physiotherapist here at the Sports Surgery Clinic, and today we're going to talk about lateral knee pain. Now, this is one of the most common complaints in runners, and as we heard from Dr Cosgrave, it comes back to the knee being a bit of a victim, and we're looking to treat the culprits, which is higher up the chain, namely the glute muscles. And also, if we do have knee pain, our quad can be a bit inhibited and we need to get that going again a little bit. So the exercise we go through now will focus on our glutes and our quads. So our first exercise is the split squat. So this is a really nice one. We get contributions from front and back leg. So the back leg we should feel at the front of the thigh, and the front leg we should feel through the left hip. So the keys to this exercise is even weight through both feet, and we move straight up and down. This is a squatting action, not a lunging action. So here we can see that front shin stays nice and vertical and the body moves straight up and down. So we get the burn on the back quad and also the front left hip. So the second exercise is a single leg hip thrust, and this is to really target the glute max muscle. So as we drive through that left foot, we curl the hips up towards the ribs. So we should squeeze the glute hard at the top and ensure we're feeling that glute max muscle at the back of the hip doing all the work. So push through the heel, curl the hips up to the ribs and squeeze the glute at the top. And the last exercise is to focus on the quad strength or recruitment if this muscle has been inhibited. So here we slide down the wall, and a few variations we can do the single leg supported. We're here on the right side, we're doing a little bit more work. And then when we go the single leg version, the right side is doing all the work. So make sure the weight's pushed through the middle of the foot and ensure the quad's working hard. So again, we go down, then easier single leg supported, and then a progression as single leg unsupported, feeling it in that quad muscle as you push through the middle of the foot. So there we have 3 simple exercises that can be done at home that help treat the causes of that lateral knee pain. So we work on targeting the glute muscles and also the quad muscles, and once the pain's under control, we can then push these exercises onto more running based exercise drills.